welcome back to XL Medical Spa. I know it's been a while, I know the videos have changed up a little bit, but let's go back to the way I was doing things for a little bit. So what I want to focus in on today is PDO Threads. You've heard all the negative aspects about it. I put out plenty of videos about it, but then let's really tackle what are some of the misconceptions about PDO Threads and what's some of the misinformation that's about PDO Threads. I want to make this safe, I want to make this comfortable, and I want to make this as educational as possible. So on top of the 5 things I list today, I want you guys to comment below on what else you want to hear about PDO Threads. Despite me doing this for, I can't remember now, 6-7 years, and despite me being a national trainer as well, I still run into the same things. Although PDO Threads has been around for a while, in comparison to, let's just say, Botox, fillers, surgery, it's still pretty new, and it also depends on who does it for you and how well trained they are. Before we get started on this episode today, don't forget I opened up a brand new location out in Solana Beach. So if you are an existing client or a new client, you can still see me in San Diego. Of course, we have the office here in Tustin. And then if you really need to see me a little bit farther north, closer to LA, I've also teamed up with the group up there near Walnut and Diamond Bar and Roland Heights as well. So you can see me plenty of places in SoCal. Now for all my first-time clients, whether you're returning to me at the new practice in San Diego, or you are a new patient that I've never seen before, don't forget that I'm doing Botox $950 per unit for all brand new patients. So if it's a old patient at another practice where you're coming back to me, you still get that honor. And then just new patients in general, you get that honor. So Botox $950 per unit. And then with first timers as well, it's filler. Any filler I have in stock, $450 per syringe. Remember, that only applies to the very first time. So Botox special $950, any syringe of filler that I have on hand, $450. So take advantage of that while it lasts. Now, before we dive into some of the misconceptions and misinformation when it comes up with PDO Threads, let's give a little history. What is PDO Threads? PDO stands for polydoxanone. In surgery, you may have heard of it as PDS, but they're just dissolvable sutures with a long history being used in the medical application. For aesthetic purposes, it's relatively new, but not that new. It's been around since the early 2000s, but definitely check all the videos I've done about it previously. But in the world of aesthetics, you have the common things. You have Botox, you have fillers, you have lasers, and for me, it's threads. Botox is for wrinkles, fillers is for volume, lasers is for texture and color, but there's not many things that can actually give you that physical lift. So you've done Botox, you've done fillers. To get that actual physical lift, likely you're jumping to surgery, facelift, neck lift. But now with the advent of threads, we can actually physically approximate or lift up skin and more importantly, stimulate collagen to bridge that gap between medical spa setting and the surgical setting. So again, PDO Threads is a way where we can lift skin and also stimulate collagen. The first misconception, I think is the biggest, it's how it's advertised. If on one of my earliest videos, I actually mentioned this to you guys, someone reported that there was a local Orange County medical spa that used my images before and after, and what they linked was, don't go under the knife. Why do surgery when you can have this instant lift leaving the office with no surgery? So first off, contact them. I said, hey, pull down the image. You didn't have rights to use this image. But this is the misinformation that's guiding people out there, where you've seen it on Google, you've seen it on other medical spas, you've seen it on advertisements, and they say, don't go under the knife. Why pay for surgery? Why recover from surgery? Why go through the bruising and swelling and the risk of surgery when you can just do PDO Threads? And that is one of the biggest misnomers. If you need surgery, there's no replacement for surgery. If you have so much laxity that you need to do surgery, there is absolutely no replacement for it. Now what PDO Threads can do is, we talked about it previously, it bridges that gap between Botox, fillers, and lasers and having surgery. If you're overfilled, if you have a round or fuller face, you can't constantly put in fillers to lift your face. If you have so much laxity that you can't support fillers, then that's where PDO Threads comes in as well. Too full, we just want to lift out of the way. Too much laxity, we want to lift out of the way. And that's where PDO Threads can help. Will it give you the result of a facelift? Absolutely not. Can it help improve that area before it to the point where you need a facelift, or you're just not ready for surgery? Absolutely. So can it give a lifting effect? Yes. Will it give a surgical effect? Absolutely not. And this is one of the ways I learned it myself, because I did this in the mirror. I used to do, I wonder what I could accomplish if I just looked like this. Now, if you take your finger at home, you put it anywhere on your body, This is the common area. Give yourself a gentle lift with one finger. That's what PDO Threads can do for you. Put it along the jawline and just give yourself this gentle lift without bunching a bunch of skin back here. If you have to take your whole hand and lift your face up with all this bunching skin back here, that's a facelift. But if you can be reasonably happy with just lifting your skin like this, that's where a medical spa setting will help. Number 2 is improper technique, and this will go along with anything. Who you go for Botox, who you go for fillers, and in this case, who you go for threads. Technique is huge. How long have they been doing this? Who are they trained by? How many PDO thread sessions have they done? Do they just do a certain area of the face? Because much like if you've done Botox for a long time, you go to one provider and be like, wow, that's incredible. I barely felt any pain. It was quick, it was easy, I was in and out. Another provider is they're marking on your face, they're doing all kinds of stuff, and it doesn't make you exactly feel comfortable. That's similar to PDO threads. Technique is key. It's not the threads that makes the biggest difference. It's not what brand makes the biggest difference. It's how they treat you and how much experience they have. Do they know what threads to use? Do they know how to place the threads? Do they know how many threads to put in? And that's another thing is when patients, clients ask me, how many threads are you using? I always joke around with them. I'm like, do you really want to know? Because when I say 30, 40, 50, they're like, oh my God, I had another consult and they told me 5 to 6 threads. But that's one of the biggest differences. I want to treat you to completion. I want to make you happy. So it's whose hands are doing it for you, how experienced they are, how they're trained, and how many threads have they done over the years. Number 4, which we can talk about many things when it comes to misinformation and just bad information when it comes out there, is how long do the results last? PDO threads typically last in your body 4 to 6 months. But we want to talk about how long the results are. And this goes along with number 1. This goes along with number 2, is understanding the concept of PDO threads and also understanding the technique about it. The more threads I put into you, the more collagen stimulation that occurs. Because in 4 to 6 months, when the threads are gone, your results are gone if I didn't use enough. Go to another practice, ask them to draw on you. How many threads are you putting into me and what types of threads? Barbs, cones, smooths, twists, bidirectional, single directional, whatever the case is. How many threads are they putting into you? One portion of it is how much can I actually physically lift your face, neck, and your body? The second portion is I want to put in enough threads where I'm stimulating good, tight collagen and skin. So when over the next 4 to 6 months, as you're looking better, better, and better, if I put in enough threads, I've done it appropriately, all that collagen that you will stimulate, that's how your results last 1.5 years to 2 years. And most of my clients, after all the procedures that we've done, in 1.5 years and 2 years from now, when we retake your pictures, I haven't found one patient that looks worse